Okay, welcome back. We're still with Professor Helen Rees, who's joining us via Skype. Professor Rees, welcome back. I mean, earlier we were talking about the whole notion of testing, and I'd like us to bring in, self-isolation, quarantine. What is the difference? And, at what point should people test? And if you test, what does it mean to be in self-isolation or in quarantine?
Well, I'll start with that question. So self-isolation is a voluntary process where people who think they might have been exposed to COVID-19 patient or have got early symptoms voluntarily stay at home, are careful in their own home so that they are careful in the way that they interact with other people in the house. And ideally, if you have the facility to do it, would have your own bedroom and really stay isolated and wear a mask. That's self-isolation. Quarantine has the same effect, but it's when we ask people, when the government or the Department of Health says, please, we want you now to quarantine. So for example, people who fly in from other countries are being asked to go into quarantine for 14 days. We don't know if they've been exposed or not to COVID-19. And so they're asked by the government to be isolated, and some will be in quarantine facilities, others will be able to quarantine at home. So that's the difference, but the effect is the same. We're saying if you've got COVID-19, if you may have it, you should isolate to stop it spreading.
All
and
right.
then did you want to know about the testing?
Yeah, carry on, yeah.
Okay. So unfortunately, globally, there's a shortage and real demand on tests, people can imagine. The tests that we need to use to actually identify the virus is the one that is particularly in short demand and is also quite time consuming in a laboratory. So we can't just do tests at the drop of a hat on everyone who thinks they might have COVID or would like to know. So the priority group would be people going into hospital who are sick and are suspected of having COVID-19, but also people who have to go into hospital for other reasons, where the hospital needs to know whether they have COVID-19 or not. Because, for example, if you're going to have an operation, people would want to know if you're in an ICU after that, are you infected or not? The second group that we really have prioritized are healthcare workers who are at extremely high risk, those on the front. The other group that really should consider getting a test are people who start to feel symptoms and have one of these underlying diseases that we mentioned just now, people who are diabetic or hypertensive or have lung disease. Because if they get COVID-19, even if to begin with the symptoms are mild, the course of disease for them will be worse. But if you're a fit, younger person and you have symptoms or you've been exposed, our recommendation is that you self-isolate at home. And you're particularly careful about social distancing, masks, and so on.
Thank you, Prof. Rees. Dr. Mokanzi, this question is directed to you. I mean, COVID-19 is such a devastating disease, and I think at this point, quite a lot of people are directly affected by COVID-19. What do you think the psychological impact of this disease is?
A good question. I think the psychological impact is quite vast, but it affects everyone in the family, the patient. And one of the experiences that I've had is that people that have it, let alone those that lose their life, they really lead a lonely life towards the end because your relatives can't visit you, you can't talk to them, we don't allow anything, whether it's your spouse or any close family. However, what I think we need to do is to liberate both those that are affected and those that are infected so that we don't see it as a stigmatizing illness. We need to make everyone feel empowered in knowing that so-and-so has a disease, because that means you know how to help them and you know how to protect yourself when you're close to them as much as they know how to protect you when they're with you. So
you mentioned stigma. There's quite a lot of stigma around COVID-19. Where do you think this is coming from?
It's anxiety that comes with anything new because we all don't know what's happening. You don't know whether you'll get it. So even as a doctor, I have a problem when I'm consulting to know Will I get it? Won't I get it as I get into my consulting room? But when you get into the groove of things and you realize that with good protective attire, good etiquette, hand washing and sanitizing, you will perhaps come out safe. Then you start realizing that this is just one of those epidemics where I still have to do my duty to help people, and as a result, you get on with it.
Ha re utlwa hore setjhaba sa Afrika Borwa se reng ka COVID-19. Let us hear what the nation has to say about COVID-19.
What is the important to wear a mask? So that we must know how to wear it. Because other people, they just put it like this, and then the others, they put it like this.
Okay, my question is, we're told that the coronavirus is airborne. Previously, we were told it's not airborne, it's on surfaces. If it's airborne, indeed, as it is, I social distance, am I susceptible to getting infected? And if I get infected, is it just through my skin, my mouth, my nose?
I mean, like, it's very important, like, for us to wear masks, to sanitize, because it's our health, like, so it's our life. If we don't do that, then we'll be faced with so many deaths and so many infections that are ongoing at the moment. Like, so, in terms of sanitizing, wearing a mask, for now, it's the most important thing, like, more than anything.
No, very, very important statements there. I think let's, at this point, join with Professor Rees on the line via Skype. And Professor Rees, I think one of the statements or concern raised by one of those people, that we've just watched is a valid one. The whole notion of transmission, I mean, people are told when we started, it was droplet spread. Now we hear, it's airborne spread. And obviously the question is, I mean, are we safe if it's airborne, it's transmitted via airborne? Can you just set the record straight about transmission of COVID-19?
Yes, and it's quite right. This is a new virus, so we're learning all the time and having to change our thinking when necessary. So it is definitely droplet spread. And when we cough, we sneeze, when we talk, when we laugh, when we sing, droplets will come out of our mouths. And if you're standing close to somebody, those droplets will stay for a period of time in the air, and then they can affect somebody who's close to you. That's one reason for the distancing, and a very strong reason for why we're telling everybody to wear masks. But we're also now aware that there could also be what's called aerosol spread, the airborne spread. Now, aerosol particles are smaller than droplets, and they'll stay in the air for a much longer period of time, hours, in fact. So another reason to wear the masks for all of us, it will protect you from infecting other people, but it'll give you some protection as well. But also, because we're now concerned about this aerosol spread, we're asking people to be sure that if you're in a room, that if you have windows, those windows are open, the doors are open. If you need to have a meeting, try and have it outside. And one of the sort of additional pieces of guidance we're now giving is ventilation. Make sure that you have moving air and outside air if you possibly can. But the distancing and the masks and the hand washing, because these droplets fall onto surfaces which can then get onto your hands, that's the reason why we're making all these strong recommendations.
All right, those are very, very, thank you so much, Professor Rees. I mean, those are very, very important tips, and in fact, something that we've been saying all the time. We're going to come back and wrap up and leave you with those very important messages. Please stay.